By mandate and by the statute and the constitution, Nigerian government has the national partner. That is the Nigerian Red Cross. It is the best humanitarian actor in Nigeria. It has 37 branches covering all the 36 states in Nigeria plus the national capital. They have 800,000 volunteers, part of the community, embedded into all locations and local areas in Nigeria, including the hard-to-reach area. It has the skills and capacity and knowledge and competence. It has the support of the ICRC, of the IFRC, of the Red Cross Healthcare and Movement partners. So I think what we need to redefine, we need to make sure that the Nigerian government better recognize and better support the Nigerian Red Cross as the key actor and the #1 humanitarian actor in Nigeria. I think funding is a challenge not only in Nigeria but in many parts of the globe because of the competing priorities. I mean, if you take now, we have Afghanistan, we have Haiti earthquake, so we have a lot of humanitarian issues that competing for funding. But I think my point, we need #1 to clarify the plan. What are we trying to do? And in my own views, if in Nigeria we have a good one plan, especially led by Nigerian Red Cross, that first of all bringing out the needs and gaps, but also bringing the potential. I think we should not also undermine and underestimate the importance of domestic funding and domestic possibility for people to help the Nigerian Red Cross effort. I think this is for me #1. With all of these competing international priorities, we should look more at domestic, look at the support, what we can get, not only from the national federal government, but also from the state government, but from the public at large.
As you say correctly, the British Red Cross always works together with the Nigerian Red Cross. The Nigerian Red Cross is our key partner in Nigeria, and all our work is done together with the Nigerian Red Cross. The focus of our work at the moment is related to disaster prevention, related to creating and building resilient communities, specifically now that we see more and more disasters occurring because of issues related to climate change. Before looking forward, let me just take a step backward. The British Red Cross has been for many decades working with the Nigerian Red Cross in Nigeria, mostly around the areas of disaster management, disaster prevention and health. Looking forward, our activities are very much related to some of the decisions which will be done today at this General Assembly, which is an important meeting of the Nigerian Red Cross. And we will adapt our activities to the strategic priorities of the Nigerian Red Cross. So depending on the way forward the Nigerian Red Cross is going to take, we will continue to be the partner of the Nigerian Red Cross in Nigeria.
We are trained, prepared to attend to any emergency and any crisis that might come up. And this pandemic, the COVID, has given us additional training as how to handle matters. And certainly for any organization that is out to reach to the remotest area of this country, there could be some challenges as to logistics of reaching the areas. So the only challenge we are facing is maybe sometimes logistics, but we are trying our best because of the resources we have taking us around, and we are reaching those who are vulnerable and who are being affected by all these kind of calamities. And as you can even see, even areas of conflict, we are always there. Talk less of areas of disaster, which is our normal, the first primary assignment. The Red Cross, Nigerian Red Cross Society, depends on donations and contributions from governments and persons, individuals, and organizations who come to the aid. And there's no amount that is too small to aid a victim of any calamity, and there's no amount that is too much. So all we are saying, all we need is for governments to continue assisting the Nigerian Red Cross Society in reaching out to those who might have been affected by any of the crisis or any of the calamity that has been falling our people.
One major challenge that we face actually is the lack of respect to international humanitarian law or law for combatants. Many aid workers have been highly demoralized today because the crisis is also affecting them. They are not left behind. Many have been taken captives. Many are also killed for doing their humanitarian aid work. So this is a big challenge for us. And we continue to disseminate the international humanitarian law, because they say even war has boundaries. So it makes no sense for one who is all out to support people humanitarianly, irrespective of their agitations, are now becoming the vulnerable people. So it's a very big challenge for us. The demands for humanitarian services today in Nigeria is a daily situation, and it is also across Nigeria. Previously, we had 2014 the major challenge based in Northeast, but the conditions, the situation for humanitarian crisis has now engulfed the entire country. From Southeast, the captivity, from the hotpots, from the you go to Southwest. I mean, issues are just rising all over. I mean, this is really a confounding situation. It is making the little resources we have from well-to-do Nigerian citizens, from international community, being highly depleted, that it's not able really to meet the demands of those people who are made vulnerable. So resources is one of the big gaps we have.